Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
During the whirlwind of the teenage years, where schoolwork, social activities, and self discovery take center stage, it's important not to overlook crucial aspect of gum care. Adolescence is a pivotal time for personal development, and while teenagers often focus on perfecting their smiles, they may not fully grasp the importance of maintaining healthy gums. In this discussion, we will explore the significance of gum care for teenagers, including why it matters, the challenges they may face, and practical steps they can take to ensure their gums stay healthy while navigating the exciting journey of adolescence. Hello, everyone. I'm Dr. Soumya Saluja from THIP Media, and today we have a special guest, Dr. Ketan Rajput, who will be joining us to discuss gum care during the teenage phase. Together, we will explore this topic and gain a better understanding of how to take care of our gums during this stage of life. Dr. Ketan Rajput is a dental professional with specialization in periodontology and implantology. Having graduated from the well regarded Nair Hospital Dental College in Mumbai, he has made significant contributions to academia and is recognized for his expertise in laser dentistry. Dr. Rajput offers workshops on laser dentistry across the country through Laserpedia and has published both nationally and internationally. Dr. Ketan, Tip Media welcomes you, sir.
Thank you. Thanks so much.
So, Dr. Ketan, since we all know that adolescence is a highly complex time in a person's life, so let me begin by asking that how do teenage years impact gum health, and how is it distinctive from that of children and adults?
So, firstly, to address this question, let me tell you, teenage, this is a very crucial period, as you said, right? So, this is the age group from around, you can say 12 to 18 years of age, right?
Right.
So, in this age group, as you can say, this is the most complex period of the life. Most of
Okay.
the body changes start from this age. So, you
Right.
have hormonal imbalances taking place in your body,
Right.
especially in females. Then you have most of the habits which people encounter in their lifetime. These are encountered during this age group.
Okay.
Also, apart from hormonal changes and habits, you can say most of the lifestyle changes happen. People,
Right.
or you can say teenagers, especially teenagers, they are more, you can say they are more towards having a fast lifestyle. You can say binge eating or fast foods and all these things. They are
Okay.
not more towards this raw vegetables or green leafy vegetables and everything. So
Okay.
all these things take place during teenagers. And if
Right.
you have to ask me how is it different from children and adults, so in
Right.
case of children, I feel parents are more productive towards children. It is
Okay.
all how children, the parents take care of children. It is all depends on the children's oral health care. So a
Right.
parent is always behind his or her child to take care of his or her oral health, right? And if
Right.
in case of adults, we'll say adults are more towards a matured state.
Right.
So they have a hormonal balance, or their hormonal levels are at a more stable level, and they are more towards a matured side. So they
Right.
know what is good and what is bad for them.
Okay.
But on the contrary, teenagers are in such a phase of life where they don't, or they cannot, what we can say, but they cannot decide what is good or bad for their health.
Right.
So this is the most crucial period, as you said.
So you just mentioned about the hormonal changes that the teenage children they go through. So based on that, are there any gender specific differences in gum health amongst teenagers? And if so, what factors contribute to these disparities?
So yes, there are definitely gender specific changes. So if you
Okay.
say young girls, these are more to having towards gum issues or oral
Mhm.
health related issues. And this is majorly because of the hormonal imbalances, especially the
Okay.
progesterone and estrogen, as we all know about it, right?
Right.
So these two hormones, the progesterone and estrogen, to be in a very common language, I'll say they are in a roller coaster ride. So they are
Okay.
always at a imbalance levels. So because of all these things, the blood supply is altered in the oral cavity or towards the gum, to be very specific. So
Okay.
your gums are more sensitive towards any minor changes that can happen, may it be
Okay.
plaque, bacteria, or even a minor toothbrush injury. So
Okay.
if even if a young girl has a minor toothbrush injury during this age group, she'll be more sensitive towards that as compared to an adult. So
Okay.
definitely, young girls or females are more affected in this age group as compared to boys.
And apart from, let's say, hormones and genetics, are
Yeah.
there any other key factors which are associated, with gum disease in this particular age group?
Yes, definitely. See, firstly, what all I said, that is habits like tobacco in any form, maybe tobacco
Okay.
chewing or smoking or alcohol, even for that case.
Okay.
So these are the factors which probably have main impact apart from hormonal imbalances and genetics. Apart from that, what I said, the lifestyle. So young teenagers, they are more towards fast food and binge eating. So
Okay.
in all of these things, what happens is they are more they neglect the green leafy vegetables or the fiber-rich fruits and
Mm-hmm.
even the milk and dairy products. So which
Okay.
are all essential for your body. So
Okay.
this all factors are neglected in teenagers. So
Okay.
in taking count the hormonal imbalances, the genetics, habits like tobacco, smoking, alcohol drinking, and the lifestyle, the food habits. These all
Right.
encounter during the teenage period, and these are all capable of causing damage to your body and overall your
Okay.
oral health also.
What could possibly be the key indicators, of this affected gum health in teenagers? And when should they visit a dentist for the same?
So key indicators, not only for teenagers, I'll be addressing this question for the whole public over here. So
Okay.
basically for teenagers, you can have red swollen gums, or you can have mobile teeth. Then there will be pain or tenderness associated with few teeth. Then there will be bleeding associated even while brushing your teeth or while having food, or you can
Okay.
have tenderness in your gums. Then you frequently getting oral ulcers in the oral cavity beneath your
Okay.
tongue or the cheeks. Cheek biting can be a factor also associated with this. And
Okay.
to assess when should you visit your dentist, I'll say it is never a delay to visit your dentist, right? So
Okay.
it should be like every 4 to 6 months you should visit a dentist. But
Okay.
what happens is people neglect that. Until and
Right.
unless there is no pain or something, people don't visit the dentist.
On a
So
regular
that should
basis.
not be, yeah. So that should not be the factor. People should
Okay.
visit every 4 to 6 months, and it is that time when a dentist knows what is wrong with your oral cavity, and that at that time he or she can correct it before it gets too long, and then it cannot be corrected.
So what would you recommend as, like, would you recommend certain oral hygiene practices that, teenagers should carry out to maintain, their healthy gums? And how does probably would affect or impact their long-term oral health?
So for teenagers, basically, teenagers should practice oral hygiene measures, like that is brushing twice daily, then having mouth rinsing, flossing, then
Right.
having a medicated toothpaste and everything. So
Okay.
because if you're having a good oral hygiene during this period, ultimately your oral cavity is going to stay healthy. And as
Okay.
you know, oral cavity is the entry point for your entire body. So if your
Right.
oral cavity is healthy, you are going to stay healthy. But if your
Right.
oral cavity is not going to be healthy, ultimately you're in a long period of time, you're going to fall sick and everything is going to happen. So basically, you have to keep your oral cavity healthy. And for this, the dentist also plays a major role. As I said, every 6 months they should visit the dentist. Apart from maintaining the oral hygiene at home, At office or at the dental clinic, it is also important, because every 6 months, if you get your teeth cleaning done or your regular checkup done, whatever small amount of bacteria or anything load is being carried out in your oral cavity, that all will be washed out and you'll have a healthy oral cavity.
And what role do diet and nutrition play? Like you just mentioned that teenagers, they are in a habit, of
Being
getting carried away, and they do not have a very healthy lifestyle, especially in terms of eating habits. So, are there any specific foods that can either promote or hinder gum health?
So as I said, you need to have raw leafy vegetables,
Mhm.
then your fiber-rich fruits, then
Okay.
milk and dairy products. These are of at most importance, right?
Hmm.
If we have to, even if you can say fruits which are rich in vitamin C, like the lemons and uh, oranges and everything. These are
Okay.
all of utmost importance. And what all should be avoided is what all the teenagers are right now having. That is the sticky foods or candies, fast foods, and everything. So these
Okay.
are basically causing damage to your teeth and gums and overall your health. So that should be avoided.
Another lifestyle change that probably teenagers adopt is their attraction towards tobacco and cigarettes. So, how do tobacco use and the vaping effect, let's say, from e-cigarettes, which has been greatly, reduced in India comparatively, but might affect the gums of teenagers worldwide. So, what could be the long-term consequences of these habits on oral health?
Tobacco in any form is injurious to your health, right? So even if you're consuming tobacco, may it be in any form, may it be smoking or chewing tobacco, it is going to cause harm to your oral health and ultimately your body. So
Right.
tobacco, what harm it causes to your oral health or your oral cavities, it will you will have receding gums, your blood supply to the oral cavity is altered.
Mm-hmm.
Ultimately, in long term, you'll have mobile teeth, tenderness, or pain associated with your teeth, and in the long term you can say this is even carries a risk of oral cancer. So
Okay.
if teenagers at this period are properly educated to not have this kind of products, that is tobacco and smoking and everything, ultimately you are educating them in a long term period for not having the risk of oral cancer.
Okay.
Today, whenever in a age group of 12 to 18 years, I guess this is the most important age group, and these are the students where who are having the most tobacco products, may it be smoking or chewing tobacco. So
Okay.
that needs to be controlled or got down to a lower level now.
Right, because teenage is one age which is very, very vulnerable. The peer pressure and everything could contribute to these habits, I suppose. Right. Okay. So, just summarizing everything right now, uh, as a gum specialist, what proactive preventive measures would you recommend for teenagers to maintain their gum
I would just say that it is this period is a very crucial period.
health?
Teenagers, they don't know what is good or what is bad. So first, what the parents need to be educated about this, and the parents need to educate their children about this. And
Right.
ultimately, if the children is practicing a good oral hygiene, he or she is having a good oral hygiene, brushing teeth twice daily, following a proper instructions, having a good food and everything, he or she will ultimately stay healthy. And as I
Right.
said, regular dental visit is must.
And would you suggest some effective preventive measures that can be implemented, let's say, in schools or communities to improve gum care amongst teenagers?
Definitely. Schools or colleges, I feel they are the gateway of knowledge.
Right.
So if schools and colleges, they take these initiatives, and if in collaboration with dentists, or say if they are inviting dentists to have a small lectures or camp, something sort of that time, then these are the ways where the teenagers will be educated for that. See,
Okay.
whenever the schools are organizing some lectures or something like that, the
Mm-hmm.
teenagers will be in a broad spectrum where they'll get more of knowledge about this, right?
Right.
So this is the age group where they grasp also very quickly, and if
Mm-hmm.
they are educated at proper time, I feel in long term they will eventually stay healthy.
And what role does oral health literacy have in promoting better gum health in teenagers?
uh, to see, oral health literacy is like ultimately, like I addressed in your previous question, if schools are educated or your teenagers are educated at schools and colleges only, so ultimately you're educating the teenagers in this. They know in
Okay.
long term that's not going to be good for them, it's going to cause some bad harm to your oral health and ultimately to your body. So if the teenagers are made literate about this, the ill effects of tobacco, and how to maintain their oral health, and how to have a good oral hygiene during this peak period of 12 to 18 years specifically, ultimately they will, I feel they will definitely follow the instructions and maintain a good oral health. So it will be of utmost importance if this campaigns are being conducted at a regular period of time.
Probably, I suppose that audiovisual aids and let's
Yes,
say certain,
definitely,
yeah, so all of these would actually add on to these
definitely,
resources and promote oral health literacy amongst
definitely.
teenagers.
Yeah.
Great. So thank you so much, Dr. Ketan. Such an enlightening session. We are very
Thank you.
grateful for your presence today. And I'm
Thank you.
hoping that this information shared will assist numerous teenagers in achieving a confident and a radiant smile.
Thank you.
Thank you so much for joining us today. And
Thank
for
you for
more such and for more such informative videos, please subscribe to our channel and press the bell icon for regular updates. Thank you once again, sir.